Good evening, everyone. I'm Darrell Steinberg, the mayor of Sacramento, and I want to welcome you all to another edition of what we call A Shot of Truth. Our effort to educate our communities, our diverse communities, with experts about the COVID pandemic, about the importance of vaccination, and about how we can best individually and as a community get beyond this very difficult and terrible, frankly, period of time that we are all living through. I want to welcome to this edition Dr. William M. Isenberg, MD, Ph.D., the Vice President and Chief Quality and Safety Officer for Sutter Health. Dr. Eisenberg, welcome to you, sir.
Thank you so much, Mayor Steinberg. It's a delight to be with you today.
Well, thank you. Let me just tell the people watching and listening a little bit about your credentials here. You are a board-certified obstetrician and gynecologist, and you're chair of the board of directors of the Hospital Quality Institute of California, and you co-chair the healthcare committee of the Bay Area Economic Council. You are the chief, as I said, quality and safety officer for Sutter. Your job is a big one. It's to oversee the quality and safety of care provided across Sutter Health's integrated health network. And of course, you may not have been able to anticipate it 24 months ago, but that care involves the pandemic that has affected healthcare, affected lives, affected the quality of life for everyone in our communities, in our state, and in our country. You earned your bachelor's degree from the University of Michigan, go Wolverines, and your doctorate in experimental pathology from UCSF, and many other credentials here. And we're, again, really appreciative to connect with you. I want to just ask you about the stage we are in when it comes to COVID-19. There are some who are starting to talk about COVID becoming endemic as opposed to being eradicated, that we're never actually going to eradicate it. We just have to learn to live with it as the new normal. Is that your opinion? And what is the sort of dividing line about how something goes from a pandemic to being endemic and just something that in one form or another we're going to have to deal with for a long time?
Yeah, Mayor Steinberg, it's really a great question. And it's really important for all of us to understand what those distinctions in terminology are. So endemic in the world of communicable disease generally means that it is something that is with us year over year or cycle over cycle, whether it's a yearly cycle or sometimes like the locusts that come, that's, a 7-year cycle. It's a different kind of thing. It's not a disease state, but an endemic is something that we just need to learn to live with. And so what are some examples of that? Chickenpox around the world it's an endemic virus that we know is there. Influenza is endemic. Year over year, we regularly get our flu shots, right? I mean, it's something that we have learned to live with. And at this point, COVID-19 is so widespread that it is unlikely that we will completely eradicate it. Now, that's a prayer we can all send up regularly, but the likelihood that it's going to happen, I think, is vanishingly small. So
I'm sorry.
No, go ahead, please.
No, I was going to say, is that because we can continue to expect new variants like the Delta variant?
Yeah, viruses are very tricky in this. And in fact, I think we even know from the influenza virus that we've seen different versions of it come and go year over year. In fact, I think many of us know, let's use influenza as a model. Each year, there's a new vaccine that has what last year's version of the virus that was so common was, and some new ones that our epidemiologists around the world predict will be coming this year. So we try and create vaccinations that will be effective, but there is variation. This mutation is the way viruses live. It's the way they can continue their DNA, just like we continue our DNA. So it's important that we acknowledge that mutation will occur, and we have to be ready for it.
And so one of the ways, of course, we have historically dealt with endemics, which are pandemics turned to, again, the realization that even if you can't completely eradicate it, you can limit or actually prevent more serious illness and death, is through vaccinations.
Exactly right. Exactly right.
So I think it's really important and helpful if you could give a little bit of a historic perspective on the history of vaccines. I know that when when I was a child, of course, we all had the chicken pox, the measles vaccine. I just recently, as an adult, was vaccinated for shingles because that's something that uh, older guys like myself can be prone to get. Talk to us about the history of vaccines and how vaccines have, in the past, largely eradicated the most serious impacts of endemic diseases.
Yeah, it's a really great question. I mean, I think we've all heard about the Salk polio vaccine, right? I mean, there was a time when all children in school would get a little sugar cube with some flavored vaccine on it to prevent polio. I mean, this was something that killed or made people very, very sick for much of their lives. I mean, we had a president who suffered from polio, right? FDR. Um, he was infected with the polio virus. And we don't see that these days. It's because we have widespread vaccination policies that have been very beneficial at warding this off. Smallpox, another one. I mean, smallpox was a disease that was rampant, and vaccines were created against it. People were vaccinated, and that problem has now gone away. When I was a child, I tell the story. I woke up on a Christmas morning as a 9-year-old with chickenpox. And, my parents knew it. I knew it because I had pox, and I couldn't go out and interact with people. But children today can wake up with COVID, and their parents may not know. And so those kids could go to school, infect other children, infect their grandparents. So it's really important that we try and get vaccines out to people.
Of course. So much of our world, even around science, of course, is politicized.
Yes.
And obviously, there is a strong, or at least strong enough, anti-vaccination movement. And there are large percentages of people in our community, in our state, who are still not vaccinated. Some out of fear, some out of not knowing as much as they could know, and some out of ideology. To take away the politics for a moment, take away the politics out of this if we can, the argument that is sometimes made by those who are skeptical of vaccines is that they can cause either the disease itself or cause serious side effects or cause other diseases. The allegation that certain vaccines lead to autism, I know unproven, but is made. And so as a medical doctor, as a scientist, how do you respond to that sort of strain of thinking?
Well, let's start with the vaccines that cause autism. I think you mentioned in the introduction that I'm an obstetrician gynecologist, right? And so there are many times that I've had conversations with my pregnant patients about getting a flu vaccine. Now, there's really no documented cases of women who have caused their children to be autistic because of their vaccination. There's just been none of that. And the women will say, well, but I'm pregnant. I don't want to take any foreign object into my body while I'm pregnant because I don't want to do anything to the baby. The flip side of that is, let me tell you, as a doctor, you do not want to get a serious lung infection while you're carrying a child. You're breathing for that baby while they're inside. And that baby is pushing up on your diaphragm. If you get an infection in your lungs, which can be caused by the flu or caused by COVID, the likelihood you'll breathe effectively goes way down. And that baby then is at risk, is at big risk. If we have to try and resuscitate you or put you on a ventilator, that's putting your baby at risk. So it's really so much safer to get the vaccines for flu, for COVID, when you're pregnant, because, you know, your baby is number one priority for you when you're carrying it.
So what has changed over the course of the decades, where polio, the polio vaccine, the sugar cube, was just a normal course of the way we all acted? It was actually great relief, right,
Yeah,
to parents.
right.
To today, where we have these tremendous controversies, and I know your answer could be, well, the whole political environment and culture is divisive, and the media is some parts of the media can say anything without accountability, et cetera, et cetera. But is there anything else that has changed? What do we need to do better from a communication perspective to try to create greater consensus on an issue which seems common sense to me, and I know seems common sense to you?
Well, you know, it's a really good question, Mayor Steinberg. I guess the way I come at it is that it's very important for each one of us to realize that none of us will enjoy the highest level of health that we can hope for if the entire community in which we live isn't as healthy as it can be. I mean, when I go out for dinner, the person who lives in my community, who prepares my meal for me, impacts my health, right? If they have a disease that has gone untreated because it wasn't offered to them, because they have a belief system that's different from mine, they still have a potential to impact my health. And so the more each of us realize that we're all important contributors to our society. I mean, I have some capable things I can offer to people in society. I can offer them physical advice. I can perform deliveries for them. But there are things that are equally important that they provide me. They may be people that drive the Muni car in San Francisco where I live. They may be people that deliver my mail. They may be the person that prepares my meal outside. They may be the person that checks me out at the grocery store. Each one of us is really important, and the health of each one of us is important to one another. I mean, I know that you have been a staunch leader in the mental health space, and that requires complexities of medicine and politics and, and finance. But in this particular realm, all of us just getting vaccinated raises all boats in that sea, doesn't it? I mean, it doesn't require government. It doesn't require a lot of money. It just requires getting a shot in your arm.
Getting a shot. So I'm sure you've answered this question hundreds of times since the pandemic, but talk for a moment about the science of COVID vaccinations, exactly how it works and why the statistics are so clear that if you are vaccinated, you're both less likely to get COVID. And if you do get COVID, as I did, you are much less likely to experience a serious illness, hospitalization, and God forbid, 700,000 people in this country, death. What is the actual science?
So the science is, and it's opened up a whole new realm of how we approach vaccinations in the future. These new mRNA viruses, for example, are so beneficial because they take a tiny piece of protein on the surface of the virus and create antibody reaction to that tiny little piece, not the whole virus itself, none of the reproductive material of the virus, but a tiny protein on its surface. I mean, it's kind of like, imagine that my whole body is a virus. It's like making an antibody to my ear, right? Has nothing to do with any of my reproductive organs or any of the rest of me, but just to the ear. And yet it's enough that when I make an immune response to that ear, anytime it sees another ear just like that one, man, those antibodies go into action and kill all those viruses. So it's really a very beneficial way to do things without exposing us to other viruses, to the DNA. I mean, there are some historic vaccines, none today, but some historic ones that actually use live killed virus. That's not the case with this COVID vaccine.
Well,
They're all set.
reiterate that point. It does not use the
Does
dead
not use
virus.
live virus. It does not use live attenuated, which means dead virus. It doesn't use any live whole virus particles at all. And there is none of the genetic material of the virus in the vaccines at all. So you cannot get sick with disease from this vaccine.
Do you think that with the fact that you just stated, because I think most people think about vaccines, basic knowledge of vaccines, maybe definitely overgeneralized, is that a vaccine is to actually inject the disease itself so that the antibodies of the disease can attack the live disease and overwhelm it. And is COVID an exception to that general rule, or is that the modern evolution of vaccines?
That's the modern way we like to do business. And in fact, now that we've seen how effective these mRNA viruses are, we're anticipating this is going to be the future of vaccination. Is that because, I think we all probably know from getting flu shots year over year that they vary between being about 40% and 65 or 70% effective against any particular strain. And yet these vaccines are 95% effective against even getting the disease. And if you get it, you're 20 times less likely to need to be hospitalized or die from it. So, these are really, really effective vaccines.
You mentioned mental health a moment ago, which you're right, has been a public policy passion of mine for many, many decades. I call it the underattended to issue of our time.
Mm-hmm.
Talk about the obvious, which is we know that I always say that if COVID is the pandemic, the impact on people's and the community's mental health is the epidemic.
Mm-hmm.
And the obvious connection between being assured that you are healthy and at lesser risk of getting really sick and maintaining one's mental health through a difficult period of time.
Yeah, it's a really good point. And I think one of the things that we're seeing, and I'm sure you all are experiencing it well, is that this protracted period of all of us being isolated is contributing to poorer mental health for all of us. And there are some people that have well-known, well-diagnosed mental illnesses, but the rest of us are still suffering from situational mental illness right now. And the sooner we can all band together and say, let's all get vaccinated so we can get back to some semblance of normalcy, the sooner we'll be able to shed some of that sort of constant depression that many of us are living under right now. So, I think there are people that can really benefit from our intensive mental health resources, and those of us who would just like to get back to a point where we can shed this depression of COVID. And, because that's consuming resources as well. We read about the young adults and young, school-age children that are feeling depressed right now. And we have many, many young people that are feeling that same separation.
No question about it. There are many impacts and effects. Let me ask you about another one that I don't want to know. I don't know if it's a misconception or it's a frequently asked question, which is, okay, if I get vaccinated and it prevents me from getting really sick or dying around the Delta variant or the original coronavirus, what's to say that the vaccination that I get is actually going to protect me against the next variant?
It's a good question. In fact, it's the reason that these vendors, the makers of the vaccines, tested people to find out whether their antibodies were effective against some of the newer strains. And it's interesting that we found in these studies, or they found in the studies that were performed, that people who were vaccinated early on with these vaccines, been tested, mounted better immune responses to the Delta variant when it appeared than did those people that had acquired COVID without being vaccinated. So it seemed that the vaccines actually induced a stronger, more potent antibody reaction than just having the disease did. So it's the reason that we actually recommend getting a shot even if you had disease.
That's another really important point, that we all need to work even harder to get out there. So why did I get COVID? I was fully vaccinated April the 1st, and Johnson & Johnson, I'm in good shape, good physical health. Why did I get COVID?
Well, maybe, Mr. Mayor, you picked the wrong day. I mean, I hope it wasn't April Fool's Day that was the jinx for that.
Yeah, God, I hope it wasn't a placebo. I don't think it was, but
no, I don't think it was. No, I mean, what we have come to learn now that we've got information on many, many people is that you're roughly 8 to 10 times less likely to get disease if you've been vaccinated. And it's not perfect. I mean, remember the original numbers where it's 95% effective, and maybe it's a little less than that. But what it does still do, even if you get disease, it decreases the likelihood that you're going to get really bad disease. And I mean, I hope your story wasn't that you had to be hospitalized.
No,
be ventilated.
was not.
You felt lousy for a few days. You probably lost your taste of smell and things like that.
All 10 days, it was more frustrating because I didn't have the energy to do what I like to do and what my job entails. But it was inconvenient is really what it was. But I wonder what it would have been had I not been vaccinated.
Well, I think you're very fortunate that you were. And in fact, we know from the flu that there are people year over year who get their flu vaccines who get influenza. We can test them and we find out that they've got a little bit of it and they think it's a cold, right? Because what would have been the flu had they not been vaccinated comes across as just the sniffles, and they feel a little bit crummy for a few days. But influenza itself can kill people, right? Let's not forget that there's other viruses out there that are still important for us to be vaccinated against.
So let's do what I call the lightning round here as we get to the last couple minutes of our time together. Common questions. Can you be vaccinated against COVID-19 and the flu at the same time?
Great question. And the answer is yes. The provisos are, and it can actually be in the same arm as long as their shots are separated from one another, provided that you didn't have a bad reaction to your doses of COVID vaccine. If you got a single dose of J&J or the 2 doses of Moderna and Pfizer, if you had no negative immediate reaction, you can get the flu shot in the same arm. If you had a mild, tenderness or something like that in one of those COVID things, you should get your flu shot in the other arm. But yes, they can be administered together.
And the COVID-19 vaccine obviously does not protect you against the flu. So if you need to get both.
Yeah, we do not want to have what we call the twindemic, where you could get both diseases, because there have been reports, fortunately in other countries, where people have been infected with actually pneumonia, influenza, and COVID all at the same time.
God.
And you can imagine what a nightmare that would be for your poor lungs, right?
A real nightmare, yes. So what about the booster issue? Is there a difference between a booster and an additional third dose?
Yeah, really good question. So what we call the booster dose is for those people who had a full cycle, have normal immune systems, and through time, and in many cases, these are healthcare workers, because we got some of the first vaccines because we were being exposed to people the most in our jobs. So those people that began getting vaccines in December of last year, their natural immunity has waned. And so they're being offered what is called the booster dose, in much the same way that we think of some childhood diseases need boosters after a certain period of time, or we could even consider our annual flu shot a booster. It's not exactly the same vaccine. As I mentioned, we change up the composition of it year over year, but it's kind of like, let's get you going again. Let's boost that immune system. The third dose is designed for those people that we know already don't have as strong immune systems as you and I might have. So people who've had heart transplants, people that have diseases that we know lower their immune response, we want to be sure that they get not only the 1-2 punch, they get the 1-2-3 punch. So they get a third dose after they've gotten their second one.
And so the protocol now on the boosters, those with, quote, regular, normal immune systems, who've had either J&J or the double dose Moderna and or Pfizer, and they're asking the question, do I need a booster? And when? What is the answer?
So as of today, those people that got the Pfizer are eligible for a booster if they meet certain criteria. If they have reached the age of 65 or older, or work in certain professions where they're exposed to high likelihood of seeing more people that have COVID. And then those people that have certain medical conditions. Those are the three groups of people that can be boosted for Pfizer. Both Moderna and J&J are probably going to be approved sometime this week or within the next couple of weeks for booster doses, but currently they're not approved for boosters yet. They're approved for third doses, or in Moderna's case, the third dose, but they're not yet approved for the boosters.
And that's FDA approval that we're waiting for?
Yep.
And do you have any inside information about how long that may take for the FDA to make this decision?
It's a good question, and I hate to be pinned down on that one because it's coming this week or it's coming next week, and then oh wait, we've got time out here. They're talking about let's say within the next 2 to 3 weeks, we should be hearing something definitive on those two.
So we've got, a minute and a half left before we hit our half hour. And I'm going to ask you an unfair question, which is predict the future. Where are we going here with this? And what do we need to see to go in the direction that you predict?
I think we're going to get out of this. I think that the more we can put our focus on our own health in the context of our community's health, the better off we're all going to be, because that will help us eliminate COVID and turn it into an endemic virus that we know how to deal with, as opposed to a pandemic that is so disruptive of our society and our mental health and everything else. I think the more we band together and see ourselves as contributing members of a society that wants to be as healthy as possible, the better off we'll all be. And we can never forget that basic things that our mothers and grandmothers and any parent we had taught us: wash your hands, stay safe, do the good things that we know keep us from passing on disease. And get your flu shot and get your COVID shot.
Right. Not that hard.
No, it's not hard. It's this, it doesn't take somebody that's been to medical school to know the right answer on this. I mean, I think you know this, Mr. Mayor, the people of the city of Sacramento know this well, that an ounce of prevention is worth a pound of cure. And the last thing we want to give healthcare to Sacramentans. We want to give them their vaccines. We love seeing them as patients. We prefer not to see them in our hospitals, though. I mean, we'd like to see them in clinics. They're so important that we keep them healthy.
Dr. Bill Isenberg, thank you so much for your time, for your wisdom, for your clear way of expressing what you have learned over a lifetime of caring for patients. It was really valuable, and we will get your words out there. Thank you very much, Doctor.
Thank you so much, Mr. Mayor.
Good night.